Hi, my name is Kyle Clower and I'm with Serve Wisconsin. We are the Wisconsin National Community Service Board and we work the AmeriCorps programs throughout the state. Right now we're interviewing different AmeriCorps members to talk about their experience serving this year and how it was impacted by the COVID-19 pandemic. And today we're talking with Parijat. So Parijat, how are you doing today?
Doing pretty well. Thank you.
Thanks so much for talking with us today. And Parijat, could you start off by telling us about the AmeriCorps program you're serving with and what your service looked like this year before the spread of COVID-19?
Hi, my name is Parijat. I'm an AmeriCorps member serving with Volunteer Wisconsin for the term 2019-2020. I've been serving at the Marshfield Clinic with the Marshfield Child Advocacy Center as part of my program, and it's been pretty interesting actually. So I'm assuming not everybody would know, but Marshfield Child Advocacy Center is a sort of a combined social service and medical support organization for kids who have been victims of trauma and abuse. And working here, I got to interact with kids on a near daily basis. I was responsible for several, like administrative duties that kind of came in. Well, I say administrative, but, just kind of a lot of organizing the program, special projects that kind of came with the role, and just the general, working in a clinic atmosphere versus an organization that's solely dedicated to social service. So it's been very interesting. I can honestly say that no 2 days have been alike. It's just been a wonderful experience. And I mean, when we go past that, just the AmeriCorps year has been phenomenal. Our program managers have been amazing. Shout out to Brian and Shelley, and they've provided us support throughout the year. And the special opportunities that we've been able to get have been very interesting.
And then what are some of the specific activities you'll be doing with the children when they came into the center?
Obviously, as a part of Volunteer Wisconsin, my primary responsibility is recruiting volunteers and training them to support the social service organization I'm working with. However, when we didn't have volunteers present, I was often tasked with kind of helping with the childcare for patients that were coming in. And I mean, it involved, anything from literally, just kind of playing games with the kid all the way to, doing health assessments, needs assessments for the families that had come into the center. When we talk about childcare, specifically with kids that have been victims of trauma, oftentimes their behaviors are severely influenced. Some might not be able to regulate their emotions, some might be hyperactive, some might, prefer to kind of just stay away from everybody. So working at the CAC, I actually had to get, I was actually specially trained to work with kids, patients that were coming in that had experienced trauma, and, just how to interact with them, how to make them feel safe, because, there's a difference between being safe and actually feeling safe. So beyond that, I would say, beyond that, there was also kind of maintaining the sanitation that followed all patients, and it wasn't just standard cleaning partly because of right now because of COVID-19. So every patient that's coming into the center, we have to make sure that the center gets sanitized and perfectly ready for the next visit.
And then Parijat, with your service based around children coming into the Child Advocacy Center and then working with the volunteers that help the children, how was your service impacted by the spread of COVID-19?
COVID-19 was just kind of threw everything out of whack. I would, prior to COVID-19 kind of disseminating through the population, my responsibilities were kind of separated into three parts. There were special projects and events that MCHS would be doing. There was, childcare, and then there was, the AmeriCorps member part, which is volunteer recruitment, volunteer training, the volunteer program organization, and, preparation. As soon as COVID-19 hit, CAC kind of had to, put a hold on all patient visits. So that just, kind of throws half of the stuff I'm doing out the window. Then because of COVID-19, volunteer services shut down. So that was gone as well. So, originally it was kind of a rushed thing where, in the beginning, everything was just kind of chaotic because you don't really know what to do. However, as kind of time went on, all my secondary responsibilities, so any special projects I wanted to do for the CAC, they became primary, and I kind of started working on that. But I'm talking about a week and a half period. But within that window, MCAC actually sort of redesigned or refocused its resources. So the Marshfield Child Advocacy Center actually started reaching out to all the families that they had worked that they were working with presently or had worked in the past, and just the community at large. And we started seeing needs that the families had because of COVID-19. You know, like people were getting furloughed left and right, people are getting laid off left and right. So that kind of brought in a lot of needs for the families. Like all of us, like, you know, a lot of Americans live paycheck to paycheck. So all of a sudden, when you don't have a paycheck, you don't know where you're going to get the food. And if you're going to get the food, is it going to be healthy? How are you going to pay rent? How are you going to pay utilities? How are you going to keep the internet going when the kids need internet to finish their schooling? You know, how are you going to keep your phones running so you can actually, you know, live and stay connected to people outside if you're actually, you know, social distancing and staying at home? So we started doing, you know, more intensive needs assessments of the families that that we were contacting or were coming to the center. You know, we started figuring out, oh, what are your needs? We actually applied for a grant. We actually received I can't remember exactly how much money right now, but the Child Advocacy Center received a substantial grant to help support the community. And that's, you know, I was a part of that. I was responsible for, you know, making those calls, connecting with the families. When the entire CAC team would kind of come together, actually advocating for the family, like, oh, we definitely should address this need, you know, because without it, they're kind of up the creek without a paddle, that kind of stuff. But as the Child Advocacy Center kind of starts opening up more and more, you know, we've restarted doing our patient visits. So it's sort of going back to the norm, but not quite there because, you know, I mean, there's special criteria. So the entire Child Advocacy Center, you know, wherever the patient goes, those areas need to be specially, you know, sanitized because COVID-19 can stay on surfaces up to 11 days. In fact, up to 9 days. So every toy the kids are playing with, you know, every single physical space of that, you know, area has to be cleaned, sanitized, and just made ready for the next family. But you know, you can't exactly make a clean room because clean rooms aren't exactly kid friendly. You know, they won't put the kids at ease. So that's what I've been kind of doing. Beyond that, planning out, you know, what the next AmeriCorps member, you know, that will follow me, you know, what kind of projects are they going to do? Figuring out how I can actually make their term more pleasant and more manageable. Like, you know, how can I make it so that they are actually able to help the Child Advocacy Center better?
Yeah, so it's definitely been a series of challenges trying to get everything together. And then once the children start being able to come back as patients, it still has a lot of unique challenges due to COVID.
I want to say like it's messy, and it is, but I'll also say it's very exciting if that's the right word, because, you know, it's a new challenge. You know, I was never able to, you know, fall into a rut. There was no real routine. And personally, I'm a huge fan of that. I like the challenge. I've learned so much while being a part of the AmeriCorps team, you know, while being part of the Child Advocacy Center team, and it's just been fun.
And Parijat, why did you decide to serve with AmeriCorps this year?
My long-term goals are, you know, I would like to become a physician. And one thing that all medical schools kind of like is if you got a lot of volunteer experience. So that's why I originally signed up for AmeriCorps. Several people have heard me say this, but I always say that, you know, I kind of lucked out into doing good. I originally joined the AmeriCorps program to, like, you know, spend a year, get a bunch of volunteer hours, get, you know, a stipend so I can, you know, cover my, you know, finances. But AmeriCorps has just been so much more, just so much more. I legitimately feel like that I've done good. I've helped the community. I've helped my friends and family and everybody around me. And it's not just the CAC. I mean, another part of AmeriCorps that I'm involved with was the disaster relief efforts. We went to Bear Paw campgrounds in north central Wisconsin for the disaster relief last year, where AmeriCorps teamed up with Team Rubicon to help kind of rehabilitate an entire campground that was just devastated, like trees fallen everywhere and just a chaotic mess. Like, I'm not kidding you. Like, when originally when we walked in, I was kind of confused, like, why are we cleaning this area? It's just a jungle. But when you start cleaning, you're like, oh, there's an entire hiking track here. And I was there for like an entire weekend, and even in just that short window, I can definitely confidently say that I made a difference. And you don't get many opportunities to be able to say something that substantive in life. So, and yeah, AmeriCorps what actually gave me this opportunity, and because of that, I actually signed up to get certified in disaster relief training. So if I'm able to participate in future disaster relief efforts wherever, that I can take a more leadership role. So we'll see how that pans out.
Yeah, thanks. Thank you for doing the disaster relief project up in Oconto County last fall. Sure, I was up there a little bit and seeing the difference you guys were making on transitioning around that campground and a lot of the other areas in the local communities that were impacted.
Yeah, no, I'm really glad. Like I remember I was kind of on the fence, like, do I do this? Like, that's an entire weekend. I'm going to be just working the entire time. And originally when we started, I was kind of worried, like, oh, I'm just going to be so exhausted. And we were, I was working with Ben Lee and Dan Quote, who are also AmeriCorps members. And it was a lot of fun. I mean, it was kind of like a day in the park, but, we were actually serving the community.
It's like a day in the park, but also a day of like manual labor of removing a ton of storm damage at the same time.
It was just ridiculous.
And then Parijat, looking back at your AmeriCorps service this year, are there any favorite memories or highlights of your experience you might be able to share with us today?
Definitely the disaster relief effort. Like, I mean, you get to make friends. You get to meet people that you wouldn't have otherwise, people that you wouldn't have interacted with otherwise. And that was just so good. Obviously, working at the CAC and just the kind of real life, experience that I got, the perspective that I've developed because of that on the community. If I were to specify an individual event, I kind of wrote one of my great stories on this. What's it called? There was a patient who came in once and for one of their visits, and I kind of hung out with them. And during that specific visit, she was having a lot of trouble just kind of managing everything. Just managing their emotions, managing just the new environment, and she was disrupted. However, following that person had to come in a second time, and it was different, but it was specifically different because I worked with her during that first, I mean, I was just kind of playing games with her, but specifically, when that person would just kind of, start getting disruptive, start shouting or just going wild, just, all right, come on, we'll calm down. Like the CAC here, it has few rules that we do. So, one of them is no hurts, where, we and these rules are there to put the kids at ease. The no hurts rule is ensuring them that, we won't do any physical or emotional harm to them. And, that we would appreciate if they reciprocated that. The second time around when, the patient came in, they did something that, to them was kind of rude or inconsiderate. So that person actually immediately just went, no hurts, I'm sorry. And it was substantially different. So seeing that one single life that I made even marginally better, maybe in the future, that person will go back to the disruptive behavior, make this rule, but maybe they won't, and even if they do forget, there was that small window that I could actually make their day better, their parents' day better, their life better for even that iota of a moment. And that's just phenomenal. I would say that specific event is really going to stick in my mind forever. And I'll call that my best moment.
That's wonderful.
Yeah.
And then, so what are your plans for once your AmeriCorps service with Volunteer Wisconsin ends?
So once my term ends at the end of August, I'm going to be preparing for the MCAT exam. I'm concurrently also going to be taking some courses like, MCAT, medical, anatomy and physiology, that kind of stuff. medical terminology, anatomy and physiology, and anything else that kind of comes in. So there's that course load that I'm going to be completing. I'm, like I said, preparing for the MCAT. I will also, I've got some pokers in the fire right now. After working at the CAC, I've found some ideas in my head that I think would be wonderful if I can bring these projects to fruition. But yeah, long term, definitely I want to, become a doctor. And honestly, after working at the Child Advocacy Center, I'm legitimately considering becoming a trauma specialist physician in the future.
That's wonderful. What are some things you think you would carry forward from your service at the Child Advocacy Center to your medical practice once you would become a doctor?
From the CAC, I would say just moving forward, not just, as a doctor, eventually when I do become a doctor, but just also my general worldview and, my daily life, honestly. It's having more patience for people. It's being more understanding of their life that, I might not actually be aware of. It's a better understanding, or rather better comprehension of how much kindness can help others. And AmeriCorps itself, I would say volunteering, I know, volunteering is going to be one of my lifelong passions now. I want to go volunteer because I've kind of gotten a peek behind the curtains. I see the excessive need the community has at all times for volunteers, and how much of a difference a single person can make. So those are the aspects that I'll be able to carry forward in my life and try to get things done.
And so, Parijat, thank you so much for your AmeriCorps service with Volunteer Wisconsin to make a difference for children at the Child Advocacy Center.
Thanks for letting me interview and kind of share my experiences with the community at large. I really appreciate it.
Thank you so much. We really appreciate you taking the time to share your story with us today, and just thank you for the continued difference you're making. And then good luck with your future studies and endeavors and work into medical school.
Fingers crossed, right? Bye.
Thank you.